Hello, hello. Do you see this thing here? So this is a bone. And with the bone, in mature bone, we have the epiphysis, we have the physis, the metaphysis, and the diaphysis. But in the mature bone, we don't have the physis. So what do we have? The epiphysis, metaphysis, and diaphysis. Okay, so we're gonna go ahead and look at bone tumors. General information that you need to know about tumors. Okay, number one is age. Okay, most bone tumors are found in young people, like in the first 2 decades of life, that is 0 to 10 years and 10 years to 20 years, except the following. Metastasis is for the old ones. Multiple myeloma, okay, and giant cell tumor, of course, giant, big age, and then chondrosarcoma, and our nyox here is called what? Osteo-S. So it's two-faced, it's a nyox, so it has bimodality, bimodal age epidemiology in young and in old. Okay, we'll come in and talk about that intensively. Okay, good. So let's look at the location. First place, the epiphysis, this place. Yeah, so we have our giant cell tumor. You see this rhino here is very giant. We'll talk about that. And then we have our chondroblastoma. Okay. And then on the metaphysis, we have our little friend here. It's called Sikun. So Sikun, S for what? Simple bone cyst. E for enchondroma. A for aneurysmal bone cyst. C for chondrosarcoma. And then O for osteochondroma. The second O for osteosarcoma. Okay. Those are found in the metaphysis. Oh, and non-ossifying fibroma. Oof, don't forget the N. And then we go to the diaphysis. Guess is our diaphysis? Yeah, our D standing for dysplasia, that is fibrous dysplasia, damantinoma, that is adamantinoma, and dark as wings, dark flies. So that is wings sarcoma. Okay, so let's go to site. So this is the most common site of these tumors, but they can be found somewhere else. Okay, so number one is the axial extension at the vertebrae. We're gonna have what? Metastasis, multiple myeloma, osteo B, that is osteoblastoma, chordoma, and chondro S, that is chondrosarcoma, which is found in the where? In the pelvis. Okay, we go to the appendages. So here, proximal humerus, we have simple bone cyst and chondro B, that is what? Chondroblastoma. And then on our femur, we have four, FOE, A triple O. So FO, that is fibrous dysplasia in the proximal humerus, osteoid osteoma in the proximal humerus, and then on our midshift is what? Remember the duck? Ewing's sarcoma on the midshaft of femur, okay? And then on the distal femur, we're going to have our triple O and ABC. ABC, aneurysmal bone cyst. The first O is OH, that is osteochondroma. The second O is osteoclastoma. That O is osteo-S, osteosarcoma, okay? So these tumors that are found most commonly in the distal femur, the second most common site is going to be proximal tibia. So the wholeness most commonly found around the knee, but can be found anywhere else in the long bones, like in the humerus, okay? And then we go to the radiologic manifestations, what you could see, most common descriptions, okay? Number one, we have our SOP here. So if you see a SOP bubble appearance on top, that is where? On the epiphysis, that would be a giant cell tumor. If you see a bubble SOP appearance on the metaphysis, but the physis is there, so this is a young bone. So that would be what? That would be an aneurysmal bone cyst. If you see our SOP here at the diaphysis, sorry, D, that is adamantinoma D, okay? And I forgot to mention adamantinoma is most commonly found in the tibia midshaft, okay? And then we have fibrous dysplasia. You see this? This is a shepherd's crook, okay? Add ground glass appearance there. It's this bending of the proximal humerus, okay? So that is fibrous dysplasia, remember? Shepherd's crook deformity and ground glass appearance, thank you. And then we have our beautiful glass here. It has a fallen leaf sign, it has a fallen fragment sign, and a simple cyst. That is simple bone cyst or unicameral bone cysts, okay? And then here, you remember our duck? We can't take it raw, we have to fry it. What are we gonna use? Onion. So when you see onion, you remember the duck flying, A-wing sarcoma. You know, wings flying, it's in the diaphysis, that is A-wing sarcoma, okay? Onions, I need to fry my D, okay? My duck. Sorry for that. Okay, and then the next is calcifications. You remember our osteo-S, aka snaky. He has an homogeneous classification. You see, homogeneous classification. Okay, and then he also has sunburst appearance, sun rays appearance, and a Codman's triangle, that is osteosarcoma or osteogenic sarcoma. Okay, and then most common tumors generally. Number one, most common benign tumor is what? Osteochondroma. Although it's not a true tumor because it's more of a developmental abnormality, so we're going to have our most common true benign tumor. So that is osteoid osteoma, okay? Osteoid osteoma. And the reason why I chose this is because one thing about osteoid osteoma is that I can't sleep at night. I'll have to wake up and listen to music because there's severe pain which is worse at night, so I just have to be awake the whole night to listen to my music, okay? And then next, the most common malignant tumor, that is what? Metastasis from other regions. And then we have the most common primary malignant tumor in adults is what? You see multiple beads, that is multiple myeloma. We're gonna put it inside the bone marrow, okay? So the most common primary malignant tumor in children now. Our friend again. Osteosarcoma, osteo-S, nyox.